Quick note before we dive in. This is episode 67. I kicked off season 2 with a co-host, and together we recorded about a dozen interviews. I'm grateful for that chapter. It widened the lens and provided me with great insight. As the show grows, I'm back in the host chair solo to keep the pace brisk and the conversations focused. Working Healthcare exists to unpack how the system really works, because we can't fix what we don't understand. So, let's get into today's episode. I am Meredith Hirsh, and this is Working Healthcare. What happens when a surgical nurse trades scrubs for a council seat and then a mayoral run? You get someone who has spent decades solving problems in real time and wants to do the same thing for an entire city. Our guest is Fran Nachlas, current deputy mayor of Boca Raton and now candidate for mayor. Fran managed operating rooms at the Boca Raton Outpatient Surgery and Laser Center at the end of her 30-year nursing career until 2021. The following year, she traded in her stethoscope for a budget binder. She's a former Miami Dolphins cheerleader, a 7-time Boston Marathon finisher, and a 3-time Ironman triathlete. Proof she doesn't quit when it gets hard. Recently, she rode all 84 miles of Boca's bicycle map, not as a photo op. It is how she engages with the city block by block. So, why is a nurse running for mayor on Working Healthcare today? Because city decisions are health decisions. The water we drink and how we prepare for storms, emergency medical service response times, and where we place fire stations, shade, sidewalks, and protected bike lanes that prevent injuries, parks that keep seniors active and kids safe, zoning that welcomes clinics, life science companies, and the small businesses that support them, housing that lets the people who care for us live near the patients they serve, even choosing defibrillator locations, helping mental health teams respond, and gearing up for extreme heat. That's City Hall, just as much as it is healthcare. And nurses, they think in outcomes. Did the process lower risk? Did we communicate clearly? Did the plan work when the pressure was on? That mindset shows up in how a mayor sets priorities, measures progress, and brings people to the table. Residents, physicians, hospital leaders, first responders, business owners, and the advocates who keep Boca's character intact while it grows. And I love Fran's spirit and drive to create change. That's something we have in common. Oh yeah, and we're both married to doctors, but that's another story. We'll get specific on the intersection of healthcare and city leadership. If you care about how government meets real life, this conversation is for you. Fran Nachlas, welcome to Working Healthcare.
Thank you, Meredith. So happy to be here, and thanks for asking me to come.
I am so excited to have you, and I am going to ask you what I asked when you told me you were running for mayor. Why mayor, and why now?
Well, our current mayor is term limited. He's done in March. So it's time for a change. I'm up for re-election. It's time for me to either run for my own seat or run for the mayor's seat. And we have a lot going on in Boca right now and some very exciting things ahead of us. And I think it's important that we have someone here and in that seat whose feet are firmly planted in Boca, and I'm that person to do that.
So what did running an operating room or being in the field of nursing teach you about leading a city?
It taught me about making decisions quickly, efficiently, and doing what's always in the best interest of people. And that's what I've done my whole life. I've taken care of people. I've reached out to see how I can help. And I make a decision. People know where I stand. I'm upfront about things. And that's what you have to do in nursing, too. There's no time to waste. You make decisions quickly, efficiently, and in the best interest of your patient.
Did you ever think that you would be in the government sector?
Absolutely not. Absolutely not. I never thought I would. Though looking back, it was very good training. I always say being a nurse and dealing with patients for as long as I have, and I still have my nursing license 37 years later. And I'm also on my HOA board for 11 years. So doing just those two things, not including being a mother and, and dealing with everything else, trained me really, really well for what I'm doing now. We have experts in City Hall, in land planning, our attorneys. We rely on our staff. And no, I never considered that I would be in this position that I am now, but I am thrilled to be and humbled to be.
So as a nurse, you're obviously focused on people's health, right? It's what you've done your entire life. And you're also the mom of 2 girls and third grandbaby who just came into this world. So name a decision a city makes each week that really impacts the healthcare of the community.
How we take care of our roads. And let's say bike lanes. You mentioned the bikes, and we talk about bike lanes all the time, and we talk about ways to protect people and where should bike lanes be. That's something that we talk about, and our engineering department and public works department talks about. Another one is water. The water we drink. How safe is the water we drink? I proudly, every day, drink Boca tap water straight from the tap because I know it's safe. I know the head of our water department, utility department is taking care of us. And I know that we make decisions every day so our residents can do that.
So Boca is really interesting for those not very familiar with it because I live in this little subset of the county, Palm Beach County, that is actually surrounded by the entire city of Boca Raton. So what constitutes the county parameters and what constitutes the actual city parameters?
Right. Well, we have a city map and we have city limits. And it's not a perfect square. And basically out to the turnpike is all in the greater Beach and Park District, which is separate from the city of Boca Raton. So you really have to look at the city map because years ago we also annexed in the mall, but didn't go really much further than the mall. And that was annexed in from the county. I think where I live was probably annexed in the late 70s, and maybe Seasons was annexed in 25 years ago. So while it's not a perfect square, it's becoming more so, and we look at opportunities to see where else we can annex in and if neighborhoods and areas need to be or want to be annexed in.
And that's where I want to get to the larger scope, even beyond Boca Raton, to have a better understanding. Why would a city annex an area of the county, and why would an area not want to be annexed?
Right. So I have some information on that, not too in-depth information because I've not been involved yet on an annexation. But from what I've heard, there have been some neighborhoods that have asked for annexation. We have amazing world-class city services, and some neighborhoods want those services. They come together and they decide we really want to be annexed in, and it might be good for the city because of tax revenue that comes in, and we already have services out in those areas, so it makes sense. It doesn't make sense everywhere, but if it makes sense for both the neighborhoods and the area and the city, then we seriously look at it.
What are those services that are controlled by the city that somebody would say, I want to be annexed?
Our fire department, our police department, our water department, all those things. And just the way the city is run, even getting a beach permit. If you don't live within city limits, then you pay a different rate than you do for, I think it's $85 now to get an annual permit for the beach. If you are coming from the outside of the city, then you could pay up to $50 a day. So just to get things like that is very valuable to a lot of people.
Yeah, my area is not annexed, and they fought against it really because of giving up their freedoms and then paying that additional tax. But I'm on sewage. I don't even have, we don't have plumbing pipes into the city, and we actually have to have a septic system. Yeah. We had to pay ourselves to get water, county water, into each home, as opposed, prior to that, we all had wells, and some of us are still on a well system. So definitely looking at the health of a city, well water isn't always as safe as potentially city or county water. It makes it more difficult. What do you think is the healthiest part of Boca Raton?
I think our public safety is very, very high on the list. We have world-class services. We have so many great things. We have our 49 parks. We have amazing police department and fire department. And I just think all of our services together make us, it's hard to pick just one, but I would say public safety is way up there. And I'm so proud of our police officers. You know, you don't need them till you need them, or the fire department. And they work hard. They're out there in the community and doing the greatest job that they can every single day for us, and I'm grateful for their service. Especially being a nurse, I have that spot for first responders and how hard they work and what they have to do, and so I would say that service.
Yeah, we tend to call 911 at least once a week. Our average patient age is 76. Yeah. It gets a little crazy. Yeah. And once a year we go into our local fire department and bring them pizza or nice. Subs, because I just want to...
Just a way to say thank you.
Yeah, exactly. Yeah. And it's interesting who raises their hand to want to go out there, but it's usually our single women who are like, can I go to the police? Can I go to the fire department? Right. What area in Boca do you think needs a tune-up?
So I think we need, and you touched on it on your intro, is more workforce and affordable housing for the people that actually do live and work in the city. And I'm going to say it because I'm a nurse. I would like to see more affordable and workforce housing near the hospital. And I think some will be coming, and we have been working on that. And that's one of the greatest things that I think we've done since I've been on council, is to make that more of a reality. So I think that is a very worthwhile thing for us to be working on.
I think that's extremely worthwhile. Yeah. And even to bring it into the broader scope of across the country, and this is the biggest struggle. I first heard about it in San Francisco, especially with teachers, and then it became physicians. Doctors couldn't even afford to live in San Francisco. And now you have ski resorts and areas in Idaho that nobody can afford to live in. And actually, doctors are getting stipends, or they built literal apartment buildings for their physician staff to live in. And that's one of our biggest struggles. I have I have staff that drive up to an hour every day just getting into work, and that excludes any traffic challenges. So how does the city fix an issue regarding affordable housing? Like, why is it the city's responsibility?
So first of all, you're very lucky that you have staff that will drive an hour to come work at your office. It means that you treat your employees very well. Because since COVID, we've really seen a shift in what people are willing to do, anywhere from the people that work in security to nurses and teachers and people that work in all the different businesses. People don't want to drive. When I first became a nurse, I also was driving almost an hour to and from work every day, because that's where I could afford to live, outside of Atlanta, because I worked in downtown Atlanta, or in Buckhead in Atlanta. But so how do we take care of that? So what we've done is, it was about a year ago, we made an ordinance, the commercial industrial multifamily district. And we created this new district where residential could be built where it was never built before, mostly in commercial and professional office and institutional space. And we said, if you come in and you bring us a project and you make that project at least 10 to 15% of affordable and workforce housing, then you will get certain development rights that never existed before. You were never allowed to build here, but here's what we're going to give you if you help give us some workforce and affordable housing. So we've recently done that. Hopefully The first one would be breaking ground soon. It's more over in central Boca, where all that space is located. And we capped it at 2,500 units. And those 2,500 units have been spoken for pretty quickly, showing the need and showing the desire to do that. And that's the first step that we've taken. So it takes a long time to get things done in government. I've learned it's not, the quick decisions that I'm used to, but at least we got there. And it's really a great first step, and I'm proud of that moment.
How do you make sure, though, that those affordable homes are, one, affordable, and then two, really for the nurses, teachers, first responders that the city needs, and not for Florida Atlantic University students or those who are retiring and coming down to the Boca Raton area, because we do call our city God's waiting room.
Though the median age limit has dropped, age has dropped, so we're getting younger. But there are very, very strict guidelines put in place because they get tax benefits for making those units affordable. They have to remain affordable for 30 years. They have to have all the same amenities of all the other, and all the same finishes of all the other units. They cannot look any different. But there are stringent applications, and the people applying for those have to provide a lot of information to show that they qualify for these things. And when we talk about affordable, we do talk about salaries that are more in line with teachers and nurses and first responders. So let me because a lot of people don't understand affordable, and they think that it's voucher housing or Section 8 housing, as some people call it, but it's not. That is a lower amount of rent than what these units are. So in Palm Beach County, our area median income is around $104,000, unless it's changed recently, but when I first got on council, it was in the low 90s, and just over 3 years, it's raised up to about $104,000. So for an affordable housing unit, the household cannot be making more than 120% of the area mean income. So let's say $125,000. For a workforce housing unit, it goes up to 140% of the area mean income. So again, the household can't be bringing in more than $145,000. So not just individuals, like a husband and wife can't each make $100,000 and qualify. It's the household income. So there's a lot of information that's needed on the application to make sure, and we were very strong in our desire to say we want these units to go to the people who are really supposed to be in them, not just someone who knows how to work the system. So how do we make sure that it is going to teachers and nurses? It's up to us to help spread the word, and it's up to, say, the hospital, and it's up to the doctor's offices, and it's up to, it's really about communication. We need to let them know that these units are going to be coming online, and that there is a limited number, and you need to get your people over there to apply for those.
And it still makes it unaffordable, though, when we have people who are making $20, $22, $24 an hour, and they might be the head of their household, maybe a single mom with 3 kids. I have a lot of people in that situation in my medical practice, and those are the ones who are driving. Those are the ones who are either going north to Lake Worth or Loxahatchee area, which is still getting very expensive, or back in the day, it was Coral Springs that was more affordable, and now that's not even affordable.
Yes.
So how are we going to deal with, one, this influx of people coming into the city? Because I believe our current mayor just offered the entire city of New York, if Mom Donnie wins, that they should all come to Boca Raton. What are we going to do with this huge influx to make sure that we actually have the services to help and to provide for those who are flooding our city?
Right. So, yes, there was an invitation and a billboard that has gone up for businesses to come to Boca. And right now, our city staff is working hard. You know, we will always have change and we'll always have people who want to come down, but it's up to us as policymakers and as leaders to not cap the growth, because that was tried back in the 70s and ruled unconstitutional. But, you know, we need to put checks and balances on development and make sure that it's right for Boca and the right kind of development is being done. And that really takes a lot of planning. And so it's not just for today, it is for decades down the road. And yes, our population's going to grow. We need to make sure we have the infrastructure, the roads, the water capacity, the sewers, the schools. We need to make sure we have all of that and have concurrency so that we can handle everything that's coming our way and not exceed it and not decrease the quality of life for our residents who are already here.
What surprised you the most when you transitioned from your nursing role into the government role?
I would say again that things move a little slower, and we can always do better. And so streamlining and making things more efficient is something we've really been focusing on the last couple of years. Every department is working on that, and we're making some changes, and it's getting better. So I hear from people, everybody from residents to developers to business owners, that things are getting better. It's just, if something's going to be a no, they want to know it's a no more quickly, and they're okay with that. But in the past, we may not have been as efficient as we could be, but all the departments are working on that now and doing a great job. So
what makes, I'm going to put it into quotes, bureaucracy, yes, what makes the government inefficient?
There's let's just say some of our zoning has been in place for decades, and it may not be applicable to what we see and what we have today. Some of our technology, AI wasn't around 10 years ago, or maybe it was, I just didn't know about it. But, embracing technology and embracing what we have now and trying to anticipate what's coming, we need to do a better job at that. I talk all the time. So you mentioned I have two daughters. Well, we also have two sons. And yes.
I always think about your daughters, maybe because because you had two weddings that you were handling.
That's right.
I focus on the girls.
That's right. But the boys are both in tech. And, they stay on top of all the AI. And when our younger son went to Emory and told us he was looking into UX, I had no idea what UX was and what that meant for anybody in the whole world. Do you know what UX is?
No, I don't.
User experience. Oh. So when you are on a website and it's working really well and you're finding everything that you love, and not just websites, but everything, it's because someone who's dedicated to user experience worked on that site.
Everything's shortened. That's all I know
UX,
from my
UI,
from my 19-year-old.
There's acronyms all over the place. Yes. And yes, trying to keep up with all the acronyms is always fun.
Well, we have healthcare acronyms. I cannot keep up with these Zoomer acronyms. I will lose my mind. What's one city service you'd redesign with the checklist that you could create? Because managing an operating room, you have to be on because they are scheduled and they need to run on time. And when they don't run on time, that needs to be an anomaly. You were a cheerleader. You know exactly the need for precision. And that's just because I'm all about the Dallas Cowboy Cheerleaders Netflix show that I've been in love with, because man, does Kelly know how to run a business. But what do you see that you need to redesign in the city that you could utilize from all of your experiences?
Right. I don't know if I would redesign it from the ground up, because our city staff has spent decades and decades working on perfecting things. I just want to go back to making things more efficient, making things more streamlined. When we have almost 200 people that work in our IT department, and I would like to see them embrace AI more. And how can we introduce it more into the city? I know as far as our traffic signals go, we hear lots and lots about traffic. And I was stopped at a traffic light and there was nobody around, and we're all sitting there looking back and forth going, Why are we stopped here? And there's different reasons why. An emergency vehicle could have just gone through that resets the lights. Our traffic division works on it all the time, but there are advances in AI that can really help us. So I would like to see stuff like that implemented.
How will you measure success? Since working in the government seems to be the long game, how are you, during your time as mayor, going to measure whether or not you were successful?
We have a safe, connected, strong financial city that people feel their quality of life is the highest and couldn't get any better, that we all enjoy our parks and our beaches. We know our city leaders. We feel connected to them and communicative with them, and that we just couldn't ask for anything more. You know, we have bits and pieces of that. We really do. We're very strong financially, but we're just like every other city in the country that is always looking to what are our future revenue streams going to be. And that's something that we always have to think about. So just feeling like the residents feel like they're connected to us, that they have a voice, that we take care of all of our city services. We continue to have world-class services. We stay ahead of our infrastructure needs, far ahead of our infrastructure needs, and plan for the people that are going to be coming here and the people who already live here.
And how long is the term?
3 years.
And you're going to assess this within a 3-year period of time?
I am going to hit the ground running, and we're already doing some of those things. Yes, it is a lot. It is a lot to happen, but we have a new city, we may have a new city manager. We are offering the job to someone as of last week. Probably by the time this airs, we'll know if he accepts or not. And he was the CEO at Pearl Harbor, the Pearl Harbor base in Hawaii, and down at the Key West Naval Base as well. And he's used to handling multi-billion-dollar infrastructure projects and getting them done in 2 years. So I think we can get a lot done.
That's amazing. When do you know that you can handle the decision, or you and your colleagues that were appointed officials can handle the decision, or when you actually need input from the public?
Well, I think we always need input from the public. We're elected to make the decisions, and not every decision goes to a referendum or, gets decided on by the public. But, there are certain thresholds that we have more discussion. We always have public comment, and we generally, always listen to what the public is saying. I reach out to everyone who emails me, or I love when people put their phone number in an email, because I just pick up the phone and give them a call, and they're always surprised when I do that. But I do that because it is important for me to listen. I don't know everything, obviously. Listening to someone, you never know who you're going to be on the phone with. That person could have been a city planner in New York City for 50 years and has some insight that they could help me with. They may be a professor at FAU that talks about urban planning, and I want to hear from them. So we have a lot of really amazing people in our city. I think it's important to listen to them and to hear from them. There are some decisions that we've had plenty of data. We know, going into it, this is going to be a really good thing for the city. It doesn't mean we don't get public comment, because we still do. But on those kinds of decisions, there generally isn't a lot of public comment, because people are already on board with it.
And you recently rode all 84 miles of the bike paths within Boca Raton.
Yes.
What did that teach you that reading the map wouldn't teach you?
Sure. So, being on the road with traffic is very different than looking at the map, and feeling it. When cars are buzzing by you on Dixie Highway at 70 miles an hour, and you're in a bike lane that really is not a wide enough bike lane, but is a designated bike lane, it's a very different feeling. And I wanted to know, and I actually did this right when I got on council. I spent a few months going out on the weekends and picking different segments to go out on. And as you mentioned, I'm a 3-time Ironman, so I've ridden my bike thousands and thousands of miles, but I haven't ridden it on all these bike lanes, and I would ride them out, and then we have 84 miles, but I would ride in both directions, really get the feel. I would ride during high traffic times, I would ride during school times, to really get that feeling, and the conditions of the roads, where signage needs to be, what are very high stress points, what are comfortable areas to bike in. And I came back and I had a lot of really good discussion with our staff about it. So small changes have been being made. We actually, during Mobility Week in October, are going to have a little get together about micromobility and about bikes and e-bikes, and talk about a quick build that they're going to do in the downtown, because we're talking more about that. And they're listening and they're responding. And you really need to have boots on the ground and eyes on the road to know what certain things feel like. You can't just read about them in the books. You need to get out there and see for yourself.
Experience it, right?
Absolutely.
You want a teacher who's done, not a teacher who can just teach about it, hypothetically.
Absolutely.
What concerns me about biking in these lanes, because Mark and I love biking, all of our kids bike. It's interesting. There was a concert that my middle son, Dalton, and his friend went to this past Saturday. And they were in Hollywood. He's observant. And so it started at 7 p.m., which was before Shabbos would end. And so both Dalton and his friend decided they were going to bike to the Panther Stadium. That was 17 miles, Fran. Okay. It freaked me out that they were going to bike all of this way, because I'm thinking about cell phones. I am not thinking about the fact that the bike path isn't wide enough. I'm thinking about the fact that people text and call and look at their phone and skip their song or whatever they're doing while they're driving, and that's when they hit somebody. I was so grateful that they chose not to do it, and they were late for the concert, and instead they let my husband take them.
Yes.
It made me so much happier. But that's what I think about. So I really worry. So how do you eliminate that factor, which I think is the biggest risk of biking?
Of people not paying attention.
Of cell phone usage.
Right. So we just as a council supported a resolution about hands-free driving. So that means not driving without your hands, but driving without you holding a cell phone in your hands. And that's, again, a step. And what did you say was the biggest thing in bureaucracy and being in the government? It's we have to take some smaller steps to get to the larger picture. Whereas in an operating room, you're doing 20 things at once. You can't really do that here. So that small step, us bringing awareness, celebrating Bike Week, celebrating kids walk and roll to school day, us being out there and listening to residents. What are their concerns? What are your concerns about your kids being on bikes? The Greater Beach and Park District just did, they put in a great traffic garden. And if you come out of your neighborhood and you take a left on Clintmore and you go over the bridge, it's just on your left side in North Park. And a traffic garden is something where little kids can get on their bikes and ride on these little roads that are painted in this parking lot that has stop signs, yield signs, signs on the arrows on the streets, teaching them at an early age how to pay attention and what certain signs mean. And I think that's really important, because there's still some adults that fly through stop signs, that fly through red lights, that'll have the whole bike outfit on but not a helmet on. And little things like that, I'm thinking, what are you doing? But, I really like to promote the safety. I do it as much as I can. And my best friend started Boca Raton Triathletes, and she's constantly telling all of the members, and there's hundreds of members, you have to be a good steward on the road. You can't be riding all over the road, because they could cause an accident doing that. And it's not just, sometimes there's people who are white-knuckled driving behind some people in bikes. And it just takes everybody really being respectful, not rushing to get someplace. I'm always wondering, people on A1A, why they're rushing to get a certain place. And it's like, go the speed limit, be respectful, and everybody can coexist. But there's even some things like you're not supposed to wear headphones when you ride a bike. You have to be aware of everything, your surroundings. But car versus bike, a car's going to win every time. Is it really worth it to speed up and try to, get around that cyclist when you could wait, 20 seconds? And it's just up to us to keep advocating. That's what I keep doing.
And I think it's paying attention, right? And all of us thinking of the greater good, which I go back to working healthcare on this podcast and working together toward a greater good and not being so isolationist or egocentric.
Right.
Which brings me to my question about residents. When's a time when you had an amazing idea by a resident, or a resident shared a solution with you and you implemented it outside of just garnering responses, but those who actually reach out to you and say, you know what, Fran, this is what the city needs?
So let's go back to bike lanes for a second, because when I rode all those miles, I went out with residents a couple times and rode with a group of them a couple different times. And they talked to me more about raised bike lanes and protected intersections and possible quick builds. So recently, we were able to advocate for that. FDOT is redoing a part of Federal Highway from Camino up to Northeast Meisner Boulevard, and part of that part of what they're going to be doing are some raised bike lanes, which will be the first ones in Boca. And really being able to advocate to our Public Works and Engineering Department. I also sit on the governing board of the Transportation Planning Agency, and having those conversations with FDOT. FDOT implemented some of those, and I'm very excited to see that and see how they work out. But that's one thing that came out of a bike ride with residents.
That's amazing. So are you ready for a quick lightning round?
We'll see. Go ahead.
Good. So, Fran, finish this. A great day as mayor looks like.
Residents are happy. Businesses are thriving. We're in strong financial shape, and people feel safe in our city.
What was your first job?
I worked at an Eckerd's Drug as a cash out person.
Oh, I remember Eckerd.
In Delray.
Yeah, I was in Eckerd in Hollandale Beach.
Okay. Remember
yes,
Eckerd's?
I used to walk over there, Eckerd, exactly, for those who need to Google it right now listening. Who is your role model among women leaders?
Among women leaders, boy, I have a few, but my mom was my biggest role model. And while she never held an elected leadership position, she was always head of the volunteers and head of the PTA and working full time while doing that. So I would say my mom is the person who has been most influential with me as far as women goes. I work with an amazing woman leader, Yvette Drucker, who has given so much to this city and continues to give her heart and soul to this city. Chelsea Reed from Palm Beach Gardens has been an amazing mentor. Jan Savrick has done so much for the city of Boca Raton. Christine Lynn, just looking at Christine Lynn and Terry Fideli, I look at these strong leading women that just are humbly giving back to their community constantly and being leaders. We have so many women in our community that I could name that I admire and look up to.
Are you an early bird or a night owl?
Oh, I'm an early bird. We're up at least 5 a.m.
You have to be to do those Ironmen, right? What was the last great book you finished?
Oh, the last great book I finished, I go back to this book and I've read it several times, Nightingale. I love World War II historical fiction, and I just have read and reread that book several times.
I need to pick that up because I also like historical fiction.
Yes.
I went to Catholic high school and my teacher was the coach of the basketball team.
Okay.
I didn't really learn very much. I think he was there to teach basketball and not to actually teach history. So this is my way to learn history as an adult. So what is your go-to Boca Raton restaurant?
Lately, it's been 388. Have you been there?
No.
Okay.
My eyes are wide open. I'm like, wait, I need another idea. 388. What do you order?
I ordered the chicken marsala, and I ordered their penne pasta alla vodka, and everything there is so good, and their 388 chopped salad. So you can get half portions, you can get full portions. We go with friends.
If I have an issue getting in, I'll tell them to listen to this
Paulie
podcast.
is the general manager.
Okay, there you
and
go.
Maddie is the owner, and they treat you like family when you're there. The food is amazing. It's a fun atmosphere, and I've just loved it.
Oh, good. I'm checking it out.
Okay.
So what song do you play when you have a big day?
I'm not throwing away my shot from Hamilton. That song gets me pumped up. And when I need to wind down, I listen to Bubbles Up by Jimmy Buffett.
Okay. Very appropriate for being a Floridian now. I know you aren't originally from Florida, but you came down when you were young.
Yes, I did. And I'm a Jimmy Buffett fan and have been a parrot head ever since I heard him 40 years ago.
And you're a fellow Gator, so we all have to love Jimmy Buffett,
yes,
right?
Yes.
Who is the person that you call to first for advice?
My husband.
What one word do your Boca friends use to describe you?
Loyal.
And then finally, I'm going to ask you.
Okay.
If you could create one change within our greater American healthcare system, what would it be?
Treat the nurses better than they're treated now.
I love that.
Yes.
That I think every single nurse would agree with you. Every single nurse. So I thank you so much for coming on Working Healthcare.
Thank you for having me. This was a lot of fun. I appreciate it.
This was a lot of fun. And it's not just Boca related. I learned a lot about what goes on in a city. And I'm certain those who do not live in Boca Raton will also be able to garner that knowledge and be able to figure out how to hopefully create change in their city.
I hope so. Thank you.
To everyone listening, the full video of this episode is now on YouTube. Search Working Healthcare and hit subscribe so you don't miss future interviews, short clips, and behind-the-scenes moments. Got a question, an episode idea, or someone you think I should feature? Drop me a line at meredithhirsh.com. If this conversation hit home or made you think a little differently, don't keep it to yourself. Share the episode, tag a friend, or post it on social media. You can follow Working Healthcare on Instagram, Facebook, and YouTube, and connect with me on LinkedIn. That's where we keep the conversation going in between episodes. The more voices we bring into this space, the more momentum we build, because change doesn't start with a policy. It starts with a real conversation, like this. New episodes drop every Tuesday. Subscribe and don't miss what's next, because you can't fix the U.S. healthcare system until you understand how it works. Tune in weekly as we explore the inner workings of healthcare.